At the time Perseverance landed on Mars, more than 30 million miles away from the Earth, a tiny virus with the size of 80 nanometers on average killed more than 2.5 million people on the Earth. Just in the United States, more than half a million people died because of COVID-19, which is more than battle deaths in World War I and World War II combined. A review of literature shows that there are some demographic and geographic trends in cases and death. For example, the largest percentage of deaths occurred in the South region, followed by the West, Midwest, and Northeast in August 2020. In addition to the geographic trends, demographic trends were also identified in cases and deaths. As an example, a study by CDS indicates that from May to August 2020, more than 75% of deaths were aged 65 or more. In Figure 2, you can see the infection risk, hospitalization, and death by age group. The risk of death for a person 85 years old or more is 7,900 times more than the risk of a death for a teenager. Obesity and overweight put people at more risk of many other diseases, including diabetes, heart disease, and certain cancers. This research was aimed to explore the relationship between adult overweight and obesity and COVID-19 cases and deaths in the United States at a county level. Overweight and obesity data in 2010 were taken from census data. COVID data till February 21, 2021 were taken from Johns Hopkins University database. Then the number of cases and deaths per 100,000 people were calculated per county. All counties, including the District of Columbia, were categorized into 4 groups using quantiles of overweight data. We applied a one-way ANOVA on these 4 groups to see if groups are different from each other in terms of COVID-19 or they are the same. Visualizing data shows that percentage of overweight and obesity is higher in Southeast, Midwest, and Northeast, as you can see here in Figure 3. The descriptive statistics on Figure 4 provide a summary of all data. The results of one-way ANOVA that you can see here shows that the differences are significant. We can conclude that 4 groups are significantly different from each other in terms of the average COVID-19 cases and deaths. Also, results show that groups with a higher percent of overweight and obesity population experienced more COVID-19 cases and deaths. This study investigated cases and deaths by COVID-19 in relation to the percentage of overweight and obesity at county level in the United States. Results indicated that counties with more percent of overweight and obesity have more COVID-19 cases and deaths. Results of this study supports results of other studies in other countries like China, UK, Spain, Mexico, and Kuwait. As a limitation of this study, I can say that currently COVID-19 data are available at a county level. Having data in a finer resolution, in a better resolution, such as tract level data or blood group data, can lead us to a more precise modeling of the situation. Results of this study can help to identify high-risk counties. Therefore, policymakers and urban planners can make a precise plan to provide essential needs for those high-risk counties to keep cases and deaths low.